Alright, so we're trying to look at another test which could be done. This one is amniotic spectrophotometry. Well, just know that what it is a test we are looking at. Alright, just that we're talking about hemolytic disease of newborn, so this was one of the tests. But amniotic spectrophotometry can also be done for what other things, right? So just get the concept of the test, right? Instead of saying it is only done for hemolytic disease of newborn, no. Okay, so we say that it's actually a diagnostic tool. It's used to assess the severity of hemolytic disease of newborn or any other blood disorders of a newborn. Do you understand? Anyway, you see hemolytic disease of newborn, just take it on a general note. So the purpose is the test usually measure the concentration of bilirubin in amniotic fluid. Why? Because if there's red blood cell breakdown, bilirubin is released. You get? So bilirubin is a byproduct of red blood cell destruction. You understand? Alright. So elevated bilirubin levels indicate that there's actually what? Hemolysis in fetus. And now you are looking at the extent of bilirubin. So for the extent of bilirubin, you are also looking at what? The possible, like it will now show the extent of what? Blood breakdown. So for the procedure, the amniotic fluid is obtained via what? Amniocentesis. Analyzed using what? A spectrophotometry. So the optical density of the fluid is what? Measured at specific wavelength, typically between what? 365 nanometer and 550 nanometer. So a peak of 450 nanometer corresponds to what? Bilirubin levels. So interpretation: the results are plotted on a graph. Okay, deviations from the normal pattern help to determine the severity of the condition. So this information will now guide clinical decisions such as what? If there's need for what? Transfusion right there when the baby is what? Intrauterine, or maybe immediately after they give birth to the baby, there should be transfusions going in. You understand? Alright, so I think that does it, okay, to help to know the extent of bleeding in a baby.